Welcome, everyone. My name is Holly Lopez, and thank you for joining us today for the Dental and Vision for Retirees within the health service system. We have representatives today from our dental plans, and we're happy to answer your questions through the Q&A comments. That is an option for the webinar. Your microphones are going to be muted throughout the entire webinar. So we encourage everyone to ask questions in that Q&A section, and it's a channel in your menu bar, so look to that now. We do have a presentation that's been pre-recorded to allow the plan representatives to focus on answering the questions. So we'll turn on that presentation. The chat's going to be open for you to start entering those questions. And then at the end of the presentation, we'll be able to hear from our plan representatives to answer those questions. I'll be reading those questions aloud from the beginning as they come through, just so that everyone can get those answers. And our staff from Health Service System will also be in the Q&A chat answering questions. So with that, I'm going to transition over to our presentation. If anyone in the chat can give a thumbs up or you can hear, we just want to make sure that's coming through to everybody.
I can hear you.
All right, we'll begin.
Welcome to the San Francisco Health Service System Open Enrollment Webinar. We're so glad you've joined us today to learn about your benefits for Plan Year 2026. Open enrollment is a period each year when all members can enroll in benefits coverage and change their current benefits coverage for the upcoming calendar year. You can change from one plan to another, enroll or waive coverage, add remove dependents from coverage, enroll in flexible spending accounts. If you do nothing, your current year benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts each year to participate. Your new benefit choices are effective January 1st, 2026. Open enrollment starts at 8 a.m. on Wednesday, October 1st, 2025, and ends at 5 p.m. on Friday, October 25th, 2025. You may enroll online through SF MyHub, located at sfhss.org. How to enroll. Find the open enrollment tile to access the My Health benefits to make your new benefit elections. City and county employees can also access SF MyHub through the SF My portal. Paper applications must be postmarked by October 24th, 2025 to be accepted. You'll be on mute and off camera for the entire presentation. We encourage you to ask questions. We will be using the Q&A function in Microsoft Teams. Scroll through your screen to find the menu bar, either at the top or bottom of the screen, depending on whether you're using your computer or mobile device. Click on the Q&A icon in your menu bar. Click on Create Post to type your question. We will answer as many questions as time allows during the Q&A session. Please do not share personal medical information in the chat. Everyone can see it. We recommend a one-on-one consultation. If you have questions that do include personal and private medical information, please schedule a private one-on-one consultation with a health plan vendor. Our health plan vendors have open enrollment office hours. To schedule an appointment, visit sfhss.org/OE2026. If you have eligibility questions, please call SFHSS Member Services at 628-652-4700 or visit our offices at 1145 Market Street, the third floor, during our business hours listed on the screen for further assistance. And we want to remind everyone to get their annual flu shot and COVID booster to protect yourself and your loved ones this fall and winter. With that, our presentation will now begin.
Here's how your Delta dental plans will help you shine. Released in 2000, the first ever Surgeon General report on oral health emphasized the importance of oral health to overall wellness. The terms oral health and general health should not be interpreted as separate entities. Oral health is integral to general health. Oral health means more than healthy teeth, and you cannot be healthy without oral health. We now know that the mouth serves as a mirror, showing us information about other parts of our body, like systemic disease and cancer. This visual shows all the ways that our oral health can affect our overall health. Poor gum health and tooth loss can increase your risk for a variety of chronic conditions and health issues, including those shown here. Gum disease is associated with an increased risk of preterm birth, as well as low birth weight and other pregnancy complications. Oral health can even affect your mental health. Oral health issues such as untreated cavities and tooth loss may result in serious mental health issues, including depression, social anxiety, and low self-esteem. There are plan features that are here to assist with maintaining good oral health. On the DHMO plan, low to no cost copayments. On the PPO plan, diagnostic and preventive maximum waiver and SmileWay benefits that we will highlight in the presentation. Now let's take some time to go over your plan options. Let's go over the DeltaCare USA plan first. The DeltaCare USA plan offers many advantages, including most covered services at a no cost or low cost copayment to the member, no annual maximum, no deductible, no claim forms to fill out, predictable costs as your benefits guide shows all covered services and what your copayment is for those services. Getting started with DeltaCare USA is easy. Go online to look up DeltaCare USA providers. Then visit any DeltaCare USA general dentist that is accepting new patients. When your dentist files a qualifying claim, you will be added to their roster and they will become your assigned DeltaCare USA dentist for any future appointments. You must visit this dentist for future visits to receive benefits. You can change your general dentist by contacting Delta Dental by phone or through your online account. Provider changes made between the 1st and 15th of the month are effective immediately. Provider changes made on or after the 16th of the month are effective the 1st of the following month. When you visit the dentist, you don't need to bring an ID card to receive treatment. Just provide the dental office with your name, social security number or enrollee ID, and your date of birth. Your dentist will work directly with us to complete any necessary paperwork, so you don't need to worry about any claim forms. Just pay your copayment if you have one at the time of treatment. Read your plan booklet to learn more about covered procedures and copayment amounts. Specialty care is available with a referral from your primary care dentist. For out-of-area emergency care, if you need urgent care and are away from your primary care dentist, DeltaCare USA provides a limited allowance for care. A few details to keep in mind. You will be required to pay for treatment and request reimbursement. Refer to your plan booklet for specific coverage details and procedures. Let's take a quick look at some of the covered services and copayments. As you can see, there are no deductibles to meet and no annual maximum. We have highlighted some of the more common dental procedures and their copayments. Here is a look at the orthodontic coverage for children and adults, which includes all phases of ortho treatment, pre and post records, tooth extractions, and coverage for ortho progress in treatment. It also shows you the startup fee. Now let's take some time to get to know your Delta Dental PPO plan. Maximize your savings with a PPO dentist. Get the most value from the PPO plan by choosing a Delta Dental PPO dentist. You do have the flexibility to see any licensed dentist. You can visit any licensed dentist and receive coverage. You won't be charged more than your expected share. PPO network dentists agree to set fees. This means you won't be balance billed. You won't be charged more than your expected part of the bill. Here is a glance at your PPO benefits. You have no deductible when using a Delta PPO dentist. You have a $50 per person and $100 per family deductible each calendar year when using a Delta Premier and non-Delta Dental dentist. Annual maximum is $1,250 per person each calendar year, with diagnostic and preventive services waived towards the maximum. You can see there are 3 columns, all with different percentages shown. The percentage shown on the benefit sheet is the percentage that Delta will pay when a claim is incurred. As you can see, the percentage is highest when you use a PPO in-network dentist. We encourage you to use a PPO provider as they discount their fees the most. It is slightly lower when you use a Premier dentist. When you stay in network and visit one of these dentists, you won't get charged more than your expected share of the bill. Using a non-Delta dentist or out-of-network dentist may result in balanced billing and higher out-of-pocket expenses. Nitrous oxide and non-IV sedation are also covered on the PPO plan. You can save money with the diagnostic and preventive maximum waiver. Cleanings, x-rays, and exams fall under this category. When receiving those services, they are waived from your annual maximum, saving your benefit dollars. This slide is an example. If you went to the dentist and had an oral exam, x-rays, and cleaning, and the treatment cost was $350. With the diagnostic and preventive maximum waiver, your annual maximum does not go down to $900. It is still $1,250 for the year to be used on other services. Your plan includes the SmileWay Wellness Benefit, which offers enhanced coverage for higher risk enrollees. The health of teeth and gums is tied to overall wellness. Gum disease and tooth decay are associated with a number of systemic conditions, and enrollees with certain medical chronic conditions may benefit from additional teeth and gum cleanings. Delta Dental PPO enrollees can take advantage of expanded coverage if they've been diagnosed with the conditions listed on this slide. Members can self-report via their online account, and it's entirely confidential. To summarize, let's take a quick look at the differences between the PPO plan and the DeltaCare DHMO plan. In choosing a dentist, PPO plan, you can visit any licensed dentist, but we do encourage you to use a PPO provider for greater savings. DeltaCare USA plan, you do have to seek services from your primary care dentist. The PPO plan has an annual maximum, where the diagnostic and preventive services do not count towards that maximum. On the DeltaCare USA plan, there is no annual maximum or deductibles. On the PPO plan, covered services are paid at a percentage. Delta pays a percentage of the services, member pays a percentage. On the HMO plan, all of the covered services have preset payments, which are low cost or no cost. On the PPO plan, there is no referral needed to visit a specialist. On the DeltaCare USA plan, you do have to go through your primary care provider to coordinate coverage for a specialist. And for the PPO plan, the dentist will file a claim form for you if they are in network. If they're out of network, you may have to submit the claim. And on the DeltaCare USA HMO plan, there are generally no claim forms to file. We do encourage you to visit your customized website, deltadentalins.com/CCSF, for a myriad of things you can do. Our website has a wealth of information that you can access without logging in. Search for a nearby dentist in your plan's network. Be sure to choose your plan in the drop-down menu, either PPO or DeltaCare USA for the DHMO plan. You can find answers to common questions about dental care and managing costs in our enrollee support guide. Find extensive dental health and wellness information on our website. And you can also sign up for GRIN, which is our free dental health magazine that would come to your email inbox quarterly. While you don't need an ID card, if you do want one, you can log in and print your own. As a Delta Dental member, you are eligible for these member perks. Virtual dentistry, which is a video-based platform that allows you to speak with a dentist live on your phone or device. BrushSmart is a discount program on Philips and Oral-B oral healthcare products. You can also get discounts on hearing aids through Amplifon and LASIK through QualSight. Life Perks, which gives you instant access to offers from a rotating group of merchants. You'll also receive emails that let you know about the newest discounts. And wellness resources, which include online articles, recipes, videos, and more. Scan the QR code for instant access or use the URL listed here. We do invite you to socialize with us on our social media sites where we offer up-to-date dental information and wellness tips.
Welcome. My name is Monica Andrade, and today I will be discussing your dental plan options through United Healthcare. Your employer offers two different plans and a range of services from routine checkups, cleanings, to advanced procedures, ensuring you receive the best care possible. With flexible options and affordable rates, maintaining your dental health has never been easier. With the direct compensation dental plan, you have the freedom to see any dentist in our statewide network without having to choose a primary care dentist in advance. Of course, a primary care dentist can be helpful guiding and managing your oral health. So you may want to choose one anyway, or see if your regular dentist is in the network and that there is one near you in your preferred area. If you need to see a network specialist, you'll just need a referral from your dentist or contacting United Healthcare Customer Service Department. The plan is designed to fit your life in other ways too. You have no deductibles or annual spending limits, just a fixed copay for covered services and treatments. Coverage for hundreds of different dental services like crowns, braces, and silver fillings. Plus, we also have oral cancer screenings for adults 18 and older, and extra dental visits during pregnancy and the first 3 months after giving birth. Finally, preventative care is most often covered at 100% in the network with a zero copay. The oral cancer screenings just mentioned, for instance, are covered as well as preventative care. Remember that if you decide to see a dentist who's not in our network, it won't be covered by your plan, so it's a good idea to stay in the network. Who's eligible? Employees and retirees, along with their eligible dependents that would include their spouse, domestic partner, and children up to the age of 26. It's easy to let regular dental exams slip through the cracks when life gets busy, but they're crucial for maintaining your overall health. Explore your dental care options to find the best fit for you. Embrace retirement with a confident smile and discover what you've been missing. Prioritize your dental health by learning about your options so you can keep your smile bright and your life healthy. Good oral health may be linked to reducing the costs and complications of many high risk, costly conditions such as diabetes, heart, and kidney disease. Our whole person approach is designed to link medical and dental data to help close gaps in dental care for employees with chronic conditions with the goal of helping improve overall health and lower costs. Gaps in oral care are characterized as a lack of oral health care received within the previous 6 months, as well as the type of oral health care being received. For example, have you been able to get the appropriate periodontal and preventative care for your condition? We can help you identify closing those dental care gaps that may help you achieve better health and save money. Now we would like to discuss condition-specific data. Diabetes. People with diabetes are more likely to have gum disease. If left untreated, this can make it difficult for them to stabilize their blood sugar. However, those who receive gum disease treatment may see a positive impact on their blood sugar levels. Heart health. People with gum disease are nearly twice as likely to have heart disease. Pregnancy. Gum disease in pregnant women may be linked to complications such as preterm birth and low birth weight. Asthma. Employees taking asthma medication may be at risk of cavities, dental erosion, and periodontal diseases. Kidney disease. Treating gum diseases helps reduce inflammation, which can help reduce the risk of kidney failure. COPD. Periodontal disease may increase the risk for respiratory disease. We address individual needs with a whole person approach that includes both preventative and at-risk outreach. 90% of targeted employees were successfully reached by phone and or mail. Preventative care includes wellness benefits covered at 100% in the network, 2 routine checkups every year, extra cleanings and treatments for expectant mothers, annual oral cancer screenings for covered adults ages 18 and up. We help at-risk employees through enhanced benefits that provide additional preventative and periodontal benefits, including expanded coverage for pregnant employees. Our dental activation combines medical and dental data to help identify at-risk employees and assess whether they're getting dental care to manage their condition. The timely interventions also encourage employees to seek oral health care. Although many services are at no cost to you, there are some services with a copay cost. Please remember to refer to your plan summary for additional information. MyUHC.com helps make it convenient for employees to learn about and maximize their benefits. The updated look and feel to create an experience that is simpler to navigate and understand. Improve usability of content and visuals by focusing on plain language standards and clearly presented information and prioritize actions. We have common navigation, look and feel across all digital assets that includes our websites and our app. With myuhc.com, employees can find a dentist, which makes it easier to locate a network provider who is nearby. You can also get health and wellness information to learn how oral health impacts overall health. Manage your claims. You can view claim history and pay a provider. Look up your benefits. See what's covered by your plan. Easy to access and print your ID cards, which is a convenient way to show proof of coverage. Use a calculator. The cost calculator will help you find what your plan pays for a procedure and what you as the employee will have to pay, and also compare local provider fees. Once you're enrolled, you'll find information and easy to use tools on your member website at myuhc.com and in the United Healthcare app. Together, they make it easier to get the most from your dental plan. You can find a network provider near you to go through your dental plan details, review your claims, and find answers to common dental questions. You can also download and print an ID card. With your United Healthcare plan, keeping up a dental visit is designed to be easier. Simply show your ID card when you visit your dentist. You'll be taking advantage of special network rates. Then, when you're at your visit, you'll only pay the office visit copay along with a specific copay for each covered service. Those copays will depend on your plan design. Finally, once you've had your procedure, you're all done and your claim will be submitted for you. A few points to remember. Our network provides access to board-certified dentists, ensuring top quality care without the hassle of deductibles, annual maximums, or waiting periods. You won't need to fill out claim forms for covered services, making your experience seamless. Enjoy low, predictable dental costs while benefiting from good oral health, which may help reduce the costs and complications of high-risk conditions like diabetes, heart disease, and kidney disease. We address individual needs with the whole person approach, focusing on preventative care and at-risk outreach. Our coverage is network only, ensuring you receive care from the best providers. For additional benefit information, don't forget you can also log into your yuhc.com /SFHSS website. Your 2025 benefit information will be uploaded into the portal for easy access. Additional information found on the website, remember, will be searching for a provider, digital tools to access estimated costs, your health plan ID card, and view balances with claim details. We also have wellness resources that provides free program and activities in physical health, healthy eating, stress management, and flu prevention. Ready to enroll? Review your plan materials and take the opportunity in today's session to ask benefit information that may be helpful in choosing the best option for you and your family. Thank you for allowing United Healthcare to be your trusted healthcare partner.
Hi, I'm Morgan, and I want to thank you for taking the time to learn more about your benefit offering through VSP Vision Care. At VSP, our goal is to help you see well and be well for a lifetime of good vision. Let's take a look at the great vision benefits available to you. How does VSP help you prioritize your health and your budget? First, vision care is essential. Signs of over 270 health conditions can be detected during an eye exam, so it's important it's on your wellness checklist. You get savings that really stack up. Great everyday savings on eye care and eyewear, plus loads of extras so you can save all year long. You can choose high-quality care from our huge network of private practice and retail chain locations. Plus, you can shop online on Iconic. Founded by doctors focused on you, your well-being is at the core of everything we do. On the last slide, we mentioned that vision care is essential. Why is that? It's the only non-invasive way to view your blood vessels. That's how your eye doctor can detect over 270 health conditions during an eye exam. And in some cases, an eye doctor can be the first to detect signs of certain conditions, like diabetes. Even if you don't wear glasses now, your vision can change from year to year. We all deserve healthy eyes. Prioritize you and your family's eye health and wellness, and enroll in vision coverage today. Retinal screening is a quick scan that shows images of the inside of the eye. It can be used to detect eye disease and conditions as a baseline of a healthy eye. Compare year after year to detect even subtle changes. With your VSP coverage, you get a retinal screening each year for a minimal copay, and members with diabetes receive a retinal screening fully covered each year. Your plan already covers the essentials, but if you want even more savings and enhanced coverage options, upgrade your plan during open enrollment. Here's a snapshot of your plan options. With VSP Light Care, it's easy to defend your eyes from the sun's ultraviolet rays or from blue light from screens. And you don't even need a prescription. Simply visit your VSP network doctor and choose ready-made blue light filtering glasses or sunglasses. This is an especially good option for parents with children who don't need corrective lenses. With essential medical eye care, here's what's covered. Fully covered retinal screening for members with diabetes who do not have diabetic eye disease. Exams and services to treat immediate issues like pink eye and sudden changes in vision. Treatment options to monitor ongoing conditions such as dry eye, diabetic eye disease, glaucoma, and more. This coverage is supplementary, and in most cases, your health insurance will be billed first. You may be able to coordinate with your VSP benefits in order to help reduce out-of-pocket costs. If your VSP doctor doesn't participate with your medical insurance plan, VSP has you covered with only the cost of your copay. With VSP, you have access to benefits that you can use at private practice doctors, retail stores, and online. With thousands of locations, getting the most out of your benefits is easy with a Premier Edge provider, including private practice doctors, VisionWorks, and iMart Express retail locations nationwide. Your benefits go further when you visit a Premier Edge location with access to exclusive rebates and offers such as Premier Edge Promise, a worry-free eyewear guarantee, exclusive offers and savings, and advanced exam technology, including digital retinal imaging and more. And if you prefer to shop online, Iconic is the in-network online eyewear store for VSP members. You can choose from over 60 eyewear brands and over 1,600 styles. As a VSP-owned company, Iconic is the only website that seamlessly connects VSP Vision benefits to a member's account. By applying your Vision benefits, you see savings in real time. Save time and money on quality eyewear with a few easy clicks. 1. Connect your Vision insurance. 2. Select your product. 3. Upload your prescription or provide your doctor's contact information, and we'll take care of the rest. We understand that choosing a doctor is a personal decision, so we've made it easy to find the right care for you. Simply navigate to find a doctor on VSP.com. Enter the preferences that are meaningful to you. You can even use the slider to search by distance and view your choice on a map so it's easy to see how quickly you can get to each location. You've seen the everyday savings has built your VSP plan. Now let's take a look at ways you can stack your savings. 50% off additional pairs of glasses and sunglasses at VisionWorks. Prefer to shop online? VSP members save an average of $250 at Iconic, plus free shipping and returns. How about an extra $20 to save on featured frame brands? Plus, VSP members have access to exclusive member extras, like 60% off a pair of hearing aids from True Hearing and so much more. Like vision loss, hearing loss can have a huge impact on your quality of life. As a VSP member, you have access to savings on hearing aids through VSP's partnership with True Hearing. Visit truehearing.com/VSP to learn more. We also get you're busy, so we've put everything you need in one place. Your personalized dashboard on VSP.com. Before your doctor visit, view your benefit and check out special offers. After, you can view your claim and even download your vision savings statement to see how much you saved. You can even take a diabetes risk assessment. And it's easy to toggle back and forth between family members with the Switch Member feature next to your name. Get the coverage you need and save hundreds on glasses, contacts, and more. Vision insurance is worth it. See what it can do for you.
You're muted, Holly.
Thank you. We're now able to enter our Q&A session, and I can see our health plan reps have turned on their cameras because we're ready to answer questions that are.
Holly, you sound far away from the microphone.
Thank you again. Our staff is helping me make sure that everyone can hear us and see me. So we are now in our Q&A session. Our vendors have their cameras on, and I'm going to begin going through the questions. I just want to remind members that you can still send in these questions by typing into the Q&A channel, and you'll look for that Q&A box in the menu on the top of your screen. And as another reminder, please do not share medical information like your social security or your phone number or your DSW number. That's personal information, and everyone can see it on this chat. We will be ending our webinar promptly at the top of the hour, so we want to allow our representatives to support our members through this Q&A session. So we'll give ourselves till about 5 minutes till the end and give an announcement that we're almost at closure. So with that, I'm going to scroll down, and our first question came in from Irene, who says, I'm a retired dental under COBRA. My dental will be ended in December of this year. I'll turn 65 in January next year. Do I need to enroll in dental now? And so our HSS staff has responded.
I could take that question, Holly. This is Jay from SFHSS. Yes, you can enroll now, or you can enroll within 30 days after your COBRA dental ends, and you should be receiving the P&A termination letter in your mail.
Okay, thanks, Jay.
Welcome.
Irene, another question came in that they'll be turning 65. I believe this may be the same person. And the question is basic vision included in the Medicare Blue Shield PPO? And do I need to enroll in the vision plan? So we've got a comment again. Yep, Jay.
Yes, the VSP basic plan will be included with enrollment in all of our SFHSS medical plans. So yes.
Okay, thanks, Jay.
Welcome.
Moving on to our next question, which comes from Joan Kelsey. Joan says, I'll be moving to Oregon when I retire. How does that impact my dental and vision? And some of our plan reps have responded. Nancy, it looks like you responded first. If you could read out your answer.
Yeah, of course. Hold on, let me find it. So basically with the move to Oregon, if you go onto our website at vsp.com and you go to the Find a Doctor link, You can type in your new address, your new zip code, and search for a provider that way, nearby providers that way. As indicated in the presentation, you can filter by distance around the address that you're inputting. And then if you do go to an in-network provider, your benefits will work the same as they would in California.
Great. Thanks, Nancy.
You're
Monica, you
welcome.
also replied. If you could share that answer out loud.
Yeah, it's for United Healthcare. It's only within the covered area since it's an HMO plan, so only within California, unless it's an emergency, it would cover out of state.
Great. Thank you. And we have Lori also put some information in. Could you share that out loud too?
Hi. I did put in the deltadentalins.com website. Am I echoing too much for you?
There is an echo,
Okay.
yeah. If that
Let
could
me
be
turn it
adjusted.
down. If that helps. And then the phone number 888-335-8227. I apologize. These are out of order for me now.
There's still a high echo.
I am not sure that I fixed it. Let me mute and unmute. Does that help at all?
Are you on both a cell phone and?
No. I should not be.
Yeah,
Is
your
that
sound
better?
was coming through okay earlier. I'm not sure.
I'm not sure either. So that would be the contact information for Delta Dental, and you would have access to the HMO or the PPO plan. You do need to see an HMO provider if you do select the Delta Care. I'm
Okay.
so sorry about that echo.
Oh, it's better.
That sounds better.
That does.
No.
And I did nothing. That's okay.
Oh, and then it got worse. We don't know
No,
what
it
happened.
went back. We're not sure what's happening. Sometimes our technology does that to us. Lori, if you know, keep trying on your end, but we'll keep going through. The next question comes in from Annette Manafo. Will these slides be available after the meeting? That one's for Jay.
Yes, this recorded webinar will be available next week on the same web page where you registered for this webinars, and also if you will be attending other webinars, it's the same as well. Just keep checking in, but we're anticipating to get these recorded webinars in by next week.
Okay, that answers part of the question. I guess the other part is that the slides that we that were in the presentation. I'm not sure if that's Jay, if you know that answer, or if Jessica.
No, we won't be able to provide those slides, but this pre-recorded video will be in there. Jessica, did you want to add something? Sorry.
Yeah, I'd have to confirm because with all of our plan that the final slides are in the shared drive, as there are comments in the ones that I have. So that's why we're not posting the slides.
Okay, so as Jay said, the recording will be available. That's great. Okay, thank you. The next question comes in from Sharmini. Sharmini asks, do I have to opt in for the maximum waiver? And Lori, we'll check your tech again.
Oh, gosh, I hope this isn't too accurate. You do not need to opt in. That is automatic.
Okay, great. Thank you, Lori. And we'll scoot up. There's another question from Sharmini. Sharmini asks, how do I enroll for SmileWay? And Lori, you had responded to that one.
I'm sorry, could you repeat that question?
Yeah, Sharmini asked, how do I enroll in the SmileWay program?
Oh, thank you. Great question. You will need to use your free member account, and you can access that at deltadentalins.com. You can also call customer service 888-335-8227, and your provider will be contacted. So of those 14 conditions that you would qualify for the program, that diagnosing provider information would be needed to be provided to us. We will verify the condition and you will be automatically enrolled.
Okay, thanks, Lori. And it's unfortunate that that the echo is pretty strong. I'd recommend if you could jump off and then come back on. Sometimes that's
let me
what
do
clears
that.
it up. And I'm saying that just to make sure that all of our accessibility platforms can capture what you're saying, because sometimes that echo disrupts getting that. So we'll be here if you jump on and jump back on.
Yeah,
jump
and
on.
I can read your answer for the next question.
Great. Okay, so the next question came in from R, and R says, I have the same Delta provider PPO since I was employed. Now that I'm retired, I find the restorative reimbursement to providers very low, and my maximum coverage per year is much less. My out-of-pocket is very high. At retirement age, dental care is a great necessity in order to keep our teeth as healthy as possible. So the question is, why does Delta PPO decrease benefits for retirees? And I know Lori had put in the answer, but Jessica, if you wanted to speak to that a little bit more.
Yeah, and Lori, are you going to log off and log back on?
I have done so. It was very quick. Can you see me? Can you hear me?
Oh, yeah, great. Then are you ready to answer the question?
Sure.
Yeah, much improved. Yeah, thank you.
Thank you for your patience. Apologies, everyone. So you do have two options, the PPO and the Delta Care Plan. The Delta Care Plan, you do need to see an in-network Delta Care provider that is a little bit leaner network, but there is not an annual maximum, so that's a consideration. Luckily, your employer does invest in providing two options, but the PPO plan does have that maximum of $1,250. Your diagnostic and preventative does not count towards that, so that's a huge benefit. Now that's almost like having a $600 or $700 increase, making that benefit about $1,850 when those benefits are not counting towards your maximum.
Okay, thanks, Lori.
Thank you, Lori. And I can add to the decrease in benefits for retirees at SFHSS. When we look at plan design, we do try to make our plans affordable for all our members. And if we had kept the plan at what you had when you were an active employee, it would actually cost a lot more. And because in retirement, the member pays 100% of the cost for dental care, that's why you see the plan design has a lower maximum allowable amount.
Okay, Jessica, thanks for the further explanation. The next question comes in from Sharmini. Does 2 routine checkups mean 2 free cleanings every year? And that one didn't have a comment yet, so that could be a general question to our plan providers. Did the 2 routine checkups mean 2 free cleanings every year?
For Delta Dental, that does mean cleaning every 6 months, and there would be no cost associated with that, and they do not count towards your maximum. And I'll respond in the chat as well.
For United Healthcare, it is limited to 2 times every 12 months. So similar to Delta.
Great, thanks, Monica. The next question comes in from Joan Kelsey. Joan asks, if my retirement date is at the beginning of the month, so the first week, am I still covered for that entire month? And it looks like HSS staff responded. I'll hand it over to Jay.
For a new retiree, coverage will take effect on the first day of the month following the retirement effective date. So depending on your retirement date, there can be a gap between when your employee coverage ends and a retiree coverage begins. So setting a retirement date at the end of the month will help you avoid any gap in your coverage. And we provided our retiree health benefits guide on here if you have additional questions.
Great, thanks, Jay. Next question comes in from Tom, who's a Delta Dental subscriber. And Tom asks, my dentist recommended a certain procedure, but I would like a second opinion. Is a second opinion covered from another dentist? Is that covered?
Tom, great question, and thank you for the question. You could get a second opinion. Any costs associated with any of the assessment you'd be responsible for. Just make sure for the maximum cost saving on the PPO plan to get a second opinion with a PPO provider. You will pay more if you go outside that PPO network. And if you're on the Delta Care plan, you would need to see a Delta Care provider. And to do that, you would have to change a provider. It takes 15 days. So if you change providers on the 1st of the month, it would be effective on the 15th. If you change providers on the HMO, that would be the 15th of the month, effective on the 1st. So that can be a little bit more complicated on the HMO plan. So something to consider.
Okay, thank you, Lori.
And Holly, just in general, because we've had this question in the past for United Healthcare, we also do cover second opinions if you go to an in-network provider, but if you happen to go to an out-of-network provider, they will charge you $50. But as long as you go within network, you do have second opinion. You would just need to contact United Healthcare so we can set that up for you.
Okay, thanks, Monica. The next question comes in from Kitty Locke, and Kitty says, I have United Healthcare. Do I find my own dentist or am I assigned a dentist in my neighborhood community? The second question is, can I just show the digital of an ID card when I visit the dentist? And the comment came in from Monica. Go ahead.
Yes, so you are not assigned a dentist. You can either go to the website at yuhc.com/SFHSS, or you may contact us at 800-999-3367 to locate an in-network provider, but you are not assigned a dentist. And you are able to take your digital card. So if you do have a dentist in mind already, you can either call up the dentist and let them know what plan you do have. They can also let you know if they take United Healthcare, or you can walk into the dental office and show them the digital card as well.
Thanks, Monica. The next question comes in from Sharmini. Sharmini asks, does UHC cover rural areas in California like Central Valley?
Yes. So the same with, we do have providers within the area, but I always recommend that you either go back to our website where you can find an available network provider. You can put in the zip code, so then that way it can show you the nearest provider, or contact UHC.
Great. Thank you. And looks like we'll go to the next question. Diana. Diana asks, if I can see a non-network dentist for cleanings and exam, Delta PPO will pay 80% of what the dentist charges, or 80% of a set amount. If it's a set amount, what is that amount? And then also, there is an annual $50 deductible for non-network providers, and they're wondering if that's correct.
Great question. So in the PPO network, you do not have a deductible. A non-PPO dentist, you would have that $50 deductible, so that is accurate. In the PPO network, you would pay 80% of the contracted rate, so the cost. A good example, I think, is if a filling costs $1,000 in the PPO network, you would pay $200. If the cost sharing is 80%, we would pay $800. Out of network, we are reimbursing that 80% based off of our contracted rate, so that $1,000. And I can't tell you what that percentage would be, because it would just be the cost of whatever that dentist is charging, which is why it's so important to stay in that PPO network to maximize your benefit and your plan spend. And I'll go ahead and answer that in the chat as well. I'll finish that up.
Okay, thanks, Lori. The next question comes in from Helene. Helene asks, is United Healthcare dental coverage available to retirees? Is it available to Kaiser Senior Advantage members? And that one's for Monica to start with, yeah.
So it is covered for retirees. However, we have no association with Kaiser. So Kaiser may have their own dental coverage under Kaiser, but if you were to choose United Healthcare, it would be completely separate from any Kaiser network.
Okay, thanks, Monica. The next question comes in from Annette Manafo. Annette asks, Delta Care USA is half the cost of the PPO. What is the major difference and the cost advantage? And the comment came in from Lori.
Great question. The Delta Care network, you have a narrow network. You can only see a Delta Care provider, so now no out-of-network benefits for any services. And if you do change the HMO or Delta Care dentist, it takes about 15 days to reassign that new dentist. So your savings come from staying in that managed care network. Great question.
Thanks, Lori. The next question is more of a clarifying question to making sure that the video that we covered today is current to the 2026 year plan for what was presented. Monica, you responded saying that, yes, all of the recordings that came in today and in this open enrollment are current for the plan year 2026. All right, next question comes in from Sally Lou. Sally asks, can I use the 1,250 max for orthodontic work in Delta Dental PPO? So that one's for Lori.
Great question. And I'm looking at your plan and I do not see orthodontia covered in the retiree PPO plan. So you would not use that for orthodontia care.
Okay, thanks, Lori. The next question comes in from Martin Lum. Martin asks, I have a Delta Dental PPO and my wife through the company has the same, but my new dentist will charge me $288 for a $64 copay on a cleaning and x-ray. They said I would get $224 after they filed the dental claim for me. Can they do this?
So what it sounds like is possibly you're seeing a Premier dentist, not a Delta PPO dentist. And let me put in the chat our customer service and the website. And it is really important every time that you see your dentist, you're either checking online, calling customer service, and verifying at the front desk that they are still participating in the PPO plan. Just because your dentist is participating for the last 5, 10 years, the last 3 months, those changes are in real time, and providers, of course, do make changes at different times. So I would check on that because you should have zero cost sharing in the PPO network, 100% coverage. And I'll put that in the chat as well.
Thanks, Lori. The next question comes in from Helene. Helene asks, is cleaning scheduled for Delta once every 6 months or 2 times per calendar year?
It's once every 6 months.
Great, thanks, Lori.
Oh, and Lori, I'm just looking at our benefits at a glance. So you're correct in that orthodontics is not covered under PPO, but I believe it is for Delta Care USA. If that's an important benefit for members, it's covered under Delta Care USA for retirees and United Healthcare DHMO.
Thanks, Jessica. That was a question coming in from Sally Lou. That could maybe go into the comments too. Okay, we'll scroll back up, and Sharmini had a question. Sharmini asks, I'm guessing it may be referring to a former question, and Sharmini, you can clarify if we're off. But was this the question of how many cleanings for Delta, or for, I guess it'd be for UHC every 6 months, or is it 2 times per calendar year? So maybe that's for Monica, the cleaning schedule.
The cleaning, it's 2 times per 12 months consecutively.
Okay. And you
And
had
I think she also had, she also had a question. I know she put in their balance billing for Delta Dental, but then said it was for United Healthcare. So typically balance billing is when the provider charges you their full fee and also the amount, which is a difference that United Healthcare would pay. But that typically happens with out-of-network providers. And since United Healthcare is only an HMO plan, only in-network providers are contracted with United Healthcare. So there shouldn't be any balance billing. My recommendation is that you go with an in-network provider so that you don't run into any issues. But if you are seeing an out-of-network provider that is trying to charge you, we always recommend call us just so we can make sure that they truly are out-of-network or they are in-network and they're not overcharging.
Great, thanks, Monica. And I can see that now that Sharmini had asked, can you explain balance billing for Delta Dental? So Lori, if you wanted to follow up on that, that'd be great.
Everyone's so quick. I'm trying to type as well. And this was the smile away question.
No, this is, can you explain balance billing?
Oh, I'm sorry. Yes, so we have a contract with a PPO dentist. Again, go back to that filling where you have $1,000 that we've agreed on for just a general filling. So we pay the 80%, you pay the 20%. If you go to an out-of-network provider, they can charge whatever they want. And so the balance billing is, so that filling was $2,000 at this dentist office. We would reimburse on that $800 because it's $1,000 filling. So we pay $800, you pay the $200 in the PPO network. Of the balance billing would occur for that additional $1,000 outside of that contracted PPO rate. So you would actually, in that scenario, pay $1,200 for that filling, which is why it's so important for your own savings to maximize your dollars to stay in that PPO network. But you do have a choice. Does that make sense?
If not, we can put it in the chat. So thank you, Lori.
Excellent. Thank you.
And I just wanted to give an announcement that we are at the 5-minute mark, which means we are going to get through maybe 1 or 2 more questions, and we might not get to all of them. We'll also drop in the chat. I'll drop in the chat just our link to our website, so where all of our resources lie. So let's go to the next question that we can squeeze in, which is from Irene. Irene says, I understand SmileWay allows 4 times cleaning each year. Are these fees deducted from the annual max of $1,250? So Lori? This was the SmileWay question.
That is a great question. Those additional cleanings do not count towards the maximum. This is an additional opt-in program that you qualify with any of those 14 chronic conditions. And again, you can log into your member portal or get help at deltadentalinS.com or through the phone number, customer service, 888-335-8227. Great question.
All right, thank you. And the next question comes in from Diana. Diana asks, what is the Delta contracted rate for cleanings and exams?
Great question, Diana. Thank you. Contracted rates are, they are confidential, and each dentist would have a contracted rate with Delta Dental, just like anyone, just like the city would have with all of their vendors. So that's not a question I could answer. I couldn't just throw a number out there.
Okay, thanks, Diana. And the next question comes in. It's a clarifying question following up on someone else's. It's saying, Roselle asks, please repeat the information about what I would do as a retiree Medicare person who moves, and what part of the month should I contact either the district or HSS or Delta Dental for that transition into retirement, I'm guessing. I believe that was a question from the very beginning that HSS provided. If Jay, you could look through that one. We've got just about 2 more minutes left, so I'm going to look for one more. And this one is for from Diana. Diana asks, what are the PPO contracted rates for cleanings and exams? And that was what Lori had just provided too.
Yeah, and you could ask your dentist. I don't know that they would answer. And typically those are not something that someone would answer. But I'll repost that question.
Okay, great.
And then you wanted to take the Rosella's question on the enrolling as a retiree, because that would be handled by HR. Correct.
That could be something, yeah, that HSS could provide about repeating when to contact us for that retirement date. And the last question I can see coming through is, what is the maximum waiver? So it's sort of a general question, but if Lori or Monica wanted to answer.
Sure, great question. The maximum waiver is a benefit that HR has really made sure that you have great benefits. So the maximum waiver is so that your teeth cleanings that cost $350, $400 now don't count towards your maximum. So on that PPO plan, you have that $1,250. So it kind of increases your benefit by whatever those cleanings cost. I would say at least $600. So you can think of that maximum as actually being about $1,850. So if you go in for that $1,000 filling, I know I keep bringing that up, and you have the 80% cost sharing, you'd pay the 200, we'd pay the 800, but those cleanings that you go in for every 6 months would not deduct. So that does enhance your benefits.
Okay, thanks, Lori. And we are exactly at the top of the hour. Jay, thank you from HSS of dropping in our website where you can find more information. So this concludes our webinar. Thanks for joining us today and asking these great questions. Thank you to all of our vendors for answering the questions and HSS staff. And we just want to remind you to submit any of your changes during open enrollment before it ends on October 24th at 5 p.m. So thank you, everyone, and have a wonderful rest of your day.
Thank you so much for having me.